Hi, listeners. Welcome back to our next episode from the Lessons from the Playroom podcast. And we're going to be addressing a really important topic today. And with me, I have a very special guest to talk about gender diversity, which is the topic that we're going to be getting into. So let me go ahead and introduce our special guest so that we can maximize our time in this really important conversation. So I have Jennifer Shivey, who is a licensed professional counselor, registered play therapy supervisor, and an approved clinical supervisor. She focuses on supporting LGBTQ plus children and their families, particularly transgender youth. She emphasizes the ethical responsibilities of ongoing education and offers practical insights for professionals. This discussion highlights the importance of gender diversity and advocates for inclusive practices. That's what we're going to be getting into today. The goal here is to empower all of you to approach your work with compassion and commitment to equity. So, Jen, thank you so much for bringing your expertise and your commitment to this topic to our podcast.
Yeah, thank you. I'm excited to be here. I'm excited to share some stuff with everyone today.
Yeah. Well, can we just jump in
Yeah,
and
yeah.
get going here? So, um, Jen, why this topic? Why is this topic so near and dear to you?
So this topic is something that's super, super important to me. I feel like I've always been an ally. But when my own child came out, and I don't even really like to say the phrase come out. It's more like when she let me in, around age 3, 4, that she was in fact transgender. That began a journey for me of I am a lifelong learner. If there's something I don't know about, I want to find out about it. So I've read everything I could get my hands on. I went to different meetings. I connected with other parents, and it just became clear that there were a lot of well-intentioned people, a lot of well-intentioned therapists that maybe didn't have exactly all the information they needed to be super effective and just competent in this area. So that is kind of how I shifted what I was doing in my practice to meet these needs and to really work hard to create a safe space, um, so that people had a space to go to. So we work with a lot of transgender kids, a lot of kids who are just like, identifying as non-binary, or they are just figuring out where they fit kind of on the spectrum. And then the parents too, as they're navigating this, I think a lot of times the parents kind of get skipped over as, either you're in or you're out, you're supportive or you're not. And that's kind of how we think about it, almost like this parental support binary. But it's not. There's a bunch that goes into that too. So that's why it became really important to me. I was fortunate to have like a really great support network and some really amazing people in my life. And I just wanted to think, how could I do that therapeutically? So
Well, so Jen, just as you just shared your story, there's that once again the thank you to you for educating our play therapy community, but I also want to thank your child,
yeah, yeah.
right? Like, like what a gift to all of us that the conversation was started. And I love the language that you use, that you were let in
Mhm.
versus come out,
Yeah.
which actually feels really like beautifully honoring. So
Yeah,
yeah,
yeah.
yeah.
And she, and just so we know, I do have her full permission and consent to talk and to share her story and our story and how it intersects. She is very, very keen on if it can help other therapists to be good therapists for transgender kids, then I'm all in. So she's actually spoken to a couple of college classes. She's done her own little, work with me, which feels really cool for her. But she was so young that it really, I don't even think I would call it a coming out. It was really a letting in. In hindsight, I can see as early as 18 months. They were
Mhm.
very, very clear. She wanted to wear my tank tops, as t-shirts all over the house. That, and these are, this is how we work with parents, because this is the part that's like, well, Lots of kids do that, right? Lots of cisgender children do that too. They dress up in their mom's high heels, or they want to wear their, dad's work shirts or ties or whatever. And so that's exploration, right? That doesn't necessarily mean anything. But you kind of look like you look for consistent, persistent, insistent. If it keeps coming up, if it keeps just there's some kind of disconnect with, no, I really don't want to wear these clothes. I really don't want to do this. And it did feel like a much more, for us, a much more kind of gradual letting in than coming out. And she was 5. She didn't really, I mean, I guess her coming out was when she told her preschool class
Mhm,
that she was going by a different name, and that was that. So,
mhm,
but I mean, there wasn't even for her, it was more just like as soon as she had some language around it and knew that, oh, that's an option. Yeah, I'm taking that. And so
mhm.
that's also kind of what we work with kids on too, is I think we have the advantage, nowadays of we have so many terms, so many ways that a person can identify, which
Yeah.
is great. It's awesome. And it can be really, really confusing for, that say a tween who is just trying to figure out who they are in general. And
Yeah.
then lots of people find comfort in labels. They really feel a sense of belonging. This is who I am. Okay, this explains me. I fit in here. Then
Mhm.
other people, they couldn't care less, which is fine too. But there's so many labels. And if you're trying to fit into one, that can be really confusing. And so I think that's something to help kids and parents navigate, as it's not like a clear cut, this is what it is, and this is what I'm sticking with, and this is what it's going to be like for the rest of my adolescence or my life, really.
Well, I'm so glad that you brought up the labels because that was one of the pieces that I wanted to touch on just from an educational standpoint,
Mm-hmm.
because some of our listeners may hear terms that they may not understand. And,
Yeah.
I'm hearing a beautiful sort of word of caution as you're saying, which is that, it's great to understand, but we're also not going to, um, use the label as
Mhm.
a confining. I don't know if I'm saying that the right way, but we're not
Yeah.
gonna, right? It doesn't have
Yeah.
to, yeah. But I think that it's still helpful for our play therapist to get a sense of, well, what are some of the labels? So can we get into
Hmm.
that a little bit, and then we'll
Yeah.
keep going? Yeah.
Yeah. So, I mean, for labels, there's honestly just so many, and they change constantly, which is something that we also need to be aware of. Just the same. This will date this video forever now, but right now, like skibbity is very, toilet res. I don't even know what half these things mean. Nor does my 12-year-old, by the way. So,
Mhm.
that language that's very popular right now, it'll evolve, it'll change, and so will these labels. So for example, when I was a kid, the word queer was very much a derogatory term. You did not call somebody queer. You did not refer to like that wasn't something that was okay. Now, very much a very, very accepted label that's just kind of an umbrella term. So, I mean, I guess we can start there. So, queer might be a label for an individual who, you know, maybe they don't really want a label, honestly. Like it's kind of for me anyways, and also everything I'm saying is through the lens of a cisgender white female identifying person, right? So this is how I'm seeing the world. I don't live in everybody else's body. Everybody else is going to have totally different experiences that change their outlook on things. um but for me, what I have seen is, the label queer is something that's kind of an umbrella term that means I don't really need a label to appease you or to appease me or to like fit into anything else. It's just I don't fit into any box, and that's fine. I don't really want to fit into a box, but I also don't want to fit into the cisgender box or the hetero box, which is fine. So that's kind of, just more of an umbrella term. There's a lot of talk about pronouns. Are we using she, her, he, him, they, them? They, them seems to really be confusing. And honestly, it's one of those things like your brain is really good at adapting to things. If you just keep using it and keep practicing it, your brain will catch on, I promise. Um, then there's all the, kind of gender identity. So, transgender, non-binary. Non-binary is also very like, well, what do you mean you're not female or male? or, gender fluid. Sometimes you are feeling more leaning this way and more this way. These are really hard concepts, I think, for a lot of people to understand because, again, they don't live in that body. So, for me as a cisgender woman, if I looked into the mirror and I saw a male version of me staring back, that would be weird, right? It just wouldn't fit. It wouldn't connect with who I really feel like inside versus what I'm seeing in the mirror. And so, that's where we get, another term, gender dysphoria. It's just not matching up.
Mhm.
So, I guess there's so many other terms. I feel like, transgender, non-binary, those are probably the biggest ones.
But even then,
Gender
when
fluid.
you say cisgender, like for someone that doesn't even know what
Yeah.
that is, like
Yeah.
what does that mean?
It's cisgender. It's just like everything's matching up. So so me feeling as a female identifying person matches up with the body parts that I happen to be born with. So yeah, that matches up. If it didn't, then again, like if I'm looking in the mirror and I feel like a female in every which way, but I have a male with, facial hair staring back at me, it's just not gonna, it's not fitting. And so that's gonna cause a lot of, discontent just inside. So it's incongruent, right? So yeah, yeah, yeah.
So why do you think that we're hearing so much about gender diversity now?
Hmm.
What do you think is
Yeah.
happening?
I think that there's just more awareness. I think there's more awareness, and it is, finally just becoming more socially acceptable. Being transgender, being gender diverse, it's not new. It's not new at all. You can look way, 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 way back in history and find lots of evidence of people who, indigenous cultures who have people who are two-spirited. You can find, just, homosexuality, right? That's everywhere. It's just like it wasn't, in a lot of cultures, it just wasn't talked about. And especially in Western cultures, it just got, I don't know, it got a bad rap, I guess. So, it's kind of one of those things like I heard a good analogy the other day of, Mount Everest,
Mhm,
right? Mount Everest, it's really big, can't miss it.
mhm,
But there was a time that humans didn't really know it was there, right? Like it hadn't been discovered yet. Does that mean like it wasn't there until we discovered it, until we started researching it and started learning about it and figuring out like, oh, what else is going on this mountain? No, it's been there for a long, 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 long time. We just are, we're just being curious about it. We're learning more about it. We're finding out more about like, how did this come to be? Stuff like that. So I
yeah.
think that analogy kind of works too. It's not that, and this is the same for so many things out there today. It's not that it just appeared and now we have I don't know, it's a thing now. Yeah, I think it's just talked about. And I also think that there are so many, gender is not binary, it's on the spectrum. And there's so many places you can fall on the spectrum. So I think that is becoming more known and accepted too, that it just people do not fit into a box. Like none of us fit into a box of any sort. So I think that that's why it's out there more. It's also just that we're raising our children differently. We're raising our children differently to have open conversations, to ask questions, to not just take what's given to them at face value. I think that that's making a difference too. So yeah, I think it's just out there more.
Well, let's keep shedding light on the mountain. Uh,
Okay.
and then we can move into how do we support the mountain.
Okay. The mountain's doing fine. Everybody else just needs to
Right,
like accept it. But
right,
yeah.
right,
So
exactly.
yeah.
But can you share a little bit about some of the challenges and some of the struggles
Mm,
that many of these children are dealing with because the mountain sometimes
mm-hmm.
is not accepted or acknowledged?
Yes.
Or
Yeah.
even just even forget that part, just the confusion that can happen as coming to terms or coming into truth about
Yeah.
who they actually are.
Yeah, yeah.
Yeah.
I think that again, everyone's experience is different. And the things that I feel kind of shape that experience are the environment around them. A lot of times. It's not all of it, but it's a big part of it. So, I mean, if you think about, think about your average, tween, adolescent, 11, 12, 13-year-old. Um, there's so much going on with hormones and social relationships and wanting more autonomy, all of that. They're really just trying to figure out a lot of things right now, right? There's just a lot going on. So if one of those things is they are figuring out what's going on with their body too, um it just adds another layer onto just kind of sometimes a confusion, sometimes maybe a distrust of self. We see a lot of kids who show more symptoms of anxiety, some depressive symptoms. And again, just not all. Like I want to make that clear. Like not every, gender diverse kid needs therapy. But these are some of the things we see. And a lot of times it is because, one, there's that reckoning just within them, which is a lot. It's also, what does their support system look like? Even if they have, the people in their immediate family are very supportive, it's still a big change. It's, even just a change of my name is different now. Like think about how you would wrap your head around, okay, the child that I gave a name to has a different name now. And I'll support that, but it's going to take some time. It's going to take some time. I'm going to have to get used to it, and we can talk more about like some of that too. But you know, they're trying all these things on, and also it might not be the only thing they try on. So it's very common for kids to, okay, well, I feel like I identify as non-binary. Okay, great. Okay, actually, I'm not sure about that. Maybe I am cisgender. Okay, maybe, maybe I'm gay. I don't know. Maybe, and then maybe I am trans. Maybe that does fit. So, I mean, it's kind of, if you think about like, coming to that and figuring out that path on that mountain while that mountain is kind of like shifting anyways, like there's just a lot going on. And I mean, and these are just kids that, I'm just talking about kids who are kind of in that, puberty stage. A lot of our kids transition much, much younger. So, for them, it looks a little different. It's kind of like, yeah, this is what it is now. So there's that. And like, I mean, that's oversimplifying it, but it is. It's like, so I'm gonna get me some new clothes, and I'm gonna get a haircut, and I'm gonna get a new name, and then we're pretty much good. And
Mhm.
so that's kind of, what's been referred to as a social transition. Again, there's some newer terminology for that, but that's just kind of the first step. They just kind of fit like their outward persona to match more what they're feeling inside. But even that, I mean, think of how that affects the family system. So the parents are kind of navigating that change. If there's any siblings in the house, they're navigating that change too. Like, oh, I don't have a brother anymore. I've got a sister. Cool. And honestly, kids just don't care. Kids are more excited and if your shoes light up or if you're, so that's another thing too. Like when my daughter told her preschool class that they're like, oh, okay, cool. Do you want to go play with the blocks?
Mhm.
Like it was a non-issue. And if they, you know, referred to her by her old name, which is called dead naming. So if they used her dead name or dead named her, she didn't care. She was like, oh, my name's this now. Like, oh yeah, that's right. Cool, cool. Do you want to be dinosaurs when we go outside on recess today? So like it's like their minds are so flexible anyways. But the siblings, sometimes that creates different dynamics. Like, okay, so are people at school talking about that? Are their friends talking about that? How are they kind of navigating that? And I think that's one thing that happens within the family system is we see this in play therapy all the time where there's one child who just needs more support, needs more of something at the moment, and the other kids, so whoever else is in the family, like they're doing okay. They're doing okay. Let's just let them lie low, and we'll focus all our efforts over here. But then the other child is, of course, like now they're feeling left out. Now they're feeling, well, I'm not trans, so I'm not special. Like maybe I could be trans too, or so it's kind of it has a domino effect sometimes. And again, this isn't it isn't necessarily a negative thing. It's just kind of a drop in the water, and it all kind of fans out. So I think that where we see, I guess, discord is when there are parents who are not supportive. Sometimes we have parents who are divorced and one is supportive and one is not, or even if they're married, one is supportive and one is not, and that creates conflict. Extended families, a lot of people, a lot of families in this journey, they lose people. Like it's kind of part of it. There are people that are no longer in that child or that family's life anymore. So maybe that is grandparents, uncles, a nanny that's been with the family forever, friends that don't come over anymore. So, a lot of times, especially with the younger kids, because they do have a sense of, well, I got my new haircut and name and clothes, so I'm good now. Great. The parents are navigating a whole bunch of stuff on the back end of that, right? They're thinking, okay, do I change your name at school? When you go to a sports camp, do I put you in the girls group or the boys group? Do I disclose this information about you? I have, my sister won't talk to me anymore. Not in real life. My sister's great. But like my, like I have, there are people in my life that, you know, are not part of my life anymore. And I have to navigate the emotions of that for myself and also try to do that in a way that, my child understands that, okay, this person is not coming over anymore in a way that's not shaming or blaming or, because you don't want to make it like it's their fault. It's not their fault. But like that's a lot, right? That's a lot to navigate. Do you do a legal name change? Do you change the marker on their birth certificate? In Colorado, Jude's Law was passed, which allows you to go to, you can go and have your child's sex marker on their birth certificate changed. So, there's a lot of legal stuff. Do you change the name? Like how, if you change the name on insurance, what are the ramifications of that? There's a lot that people don't think about. Like if you have a transgender male who you change the marker and you change the name and you insure them under their new name, that transgender male still has a uterus that is going to need like uterus care. So, how do you now it's like, well, the insurance company is not going to cover that because it's a female covered service, right? I actually think they do now, but that was a thing for a while. So there's all of these little things that go on in the background that like families and parents and caregivers are navigating that the kids, may or may not know anything about, which is a lot, right?
Yeah. So, Jen, you had mentioned a little while ago, we can come back around on the part of the conversation, like how do we support parents and caregivers through this? So, what are some of those things that we can do that could be helpful for the parents and caregivers,
Yeah.
for the family system? Will you walk us
Yeah.
through? Yeah.
Yeah. I think that parents need their own space. So I think that it's really helpful for parents, a couple of things, to connect them with other parents of transgender children, just so they can feel like, they know they're not alone, probably. Maybe they don't, but they know they're not alone. There's probably others out there, but they don't know how many others are out there. There's a lot. And having somebody who's already walked through some of these steps and who can also talk about their emotion and their, emotional journey can be really helpful. Also just giving them one-on-one space, having them engage with their own therapy in their own space where they can talk about all these things with somebody who has some competency and has some understanding of it that can, basically not tell them, well, you just need to support your kid no matter what, and then that's it, and that's fine. Because there's one thing that doesn't get talked about, and I talk about this a lot, and when I'm teaching and kind of speaking, is that there is for lack of a better term, there's a grief and loss component that goes with this for parents, and parents don't want to talk about it because there's a feeling that if I disclose this, that I am feeling some sadness about it, then I'm not an ally. I'm not totally supporting my kid when you are. But, just the name, probably you gave that name a lot of thought. Maybe there was family meaning in it. Maybe it signified something, right? It wasn't just you looked up at a billboard and yeah, that won't work, right? There was a lot of thought given to that name. So, just letting go of that name. There's also, even if you strove to be like the most gender neutral, in raising your child, there is no way in our society that you get away from, it's a girl, it's a boy, and then kind of mapping out the trajectory of what you think that child's life may be, right? And it's not right or wrong. It's not good or bad. It's just what happens, right? So you have to reframe that in your mind. You have to like make all those connections again and kind of reset. But the grief and loss is, it can be really hard. And I just don't think that parents talk about it because they're afraid of the judgment that they might get from other people. Like, well, you mean I'm not as supportive? Like I remember, we'd already been years into this journey at this point, but the day that we finally took all the, boy clothes out of my child's closet and packed them away, and the closet was 100%, tutus and frills and pink and everything else. Like I sat on the floor with all these clothes and I just sobbed, and it was just like, and not that I don't accept my child for who she is, nothing about that. It was just a piece of it that I needed to grieve and, and then let go of. At this point, the thought of thinking about my child as a boy is so weird. Like it's so weird. I can't even like now it doesn't even compute in my head. It just wouldn't match. It's not a thing. But, I had to go through my own process. And every other parent I have talked to that has a transgender or gender diverse child has done the same thing. And they, most of the time when I bring this up, they're like, "Oh my gosh, I'm so glad you mentioned that. I didn't, I feel that too, but I, I didn't know where to put that, or I didn't know I didn't want to talk about it, you know? So
Well,
yeah.
Jen, I imagine even for some caregivers, in addition to the grief process, there can be even an initial anger, like
Mhm.
other emotion, like anger or worry.
Sadness. Yeah.
Yes, worry. Oh my gosh, what is this going to mean, right, for my child? Or so I'm
Yeah.
just hearing a really beautiful invitation also for us as clinicians to like caregivers get to feel the spectrum and they
Mhm.
get to move through the spectrum of their own experience and then it's actually really necessary and none of it means that they don't accept their child. It's their own process, although as I say that I suppose some of it could be a part that doesn't want to accept that then they might need to go in and look at what that's about,
Right.
that there is
Right.
that too. So can we
Right.
can we address that component?
Mhm.
What if we have
Yeah.
a caregiver that's really resistant to this is not my child.
There's almost always somebody within the family system who is just not on board. And a lot of times it's not the immediate family. It can be, like I said, kind of tertiary family members, I guess. Um, but it's kind of I look at this the same way that I do it just with play therapy in general. We do as much as we can to change the family system, right? So we work with the children, but we also have to work with the parents and the people in that child's life to kind of affect change all around. Because we're not magicians. There's nothing we can do in 50 minutes a week that's going to like change everything, right? It'll help, but we need to kind of work on everything. When we can't do that, or when there's a piece of it that we can't do, then we have to flip to a model of resiliency. Then we have to work more with the children themselves to how do we bolster your resiliency to face some of these challenges. So, with caregivers or support team members who are not as supportive, we do what we can to educate them. Common barriers are religion. Religion is a huge barrier just because And again, I don't want to, I know it's seen as like, oh, well, that's just religious stuff and that's negative. And that's a part of them. That's a part of, that could very well be like a huge part of somebody's identity, like for generations, that this is an important component. So I think that we have to be respectful of religion, of culture. There's a lot of cultural factors that come into play. So we need to be curious with the parents. We need to do a lot of wondering. We need to, and I say parents, I mean caregivers in general, but we need to be curious with them and get their thoughts and, challenge some of those beliefs, maybe challenge some of those narratives when we can. And it can be hard, like some people are just not going to move. I would say a lot of people do. A lot of people, there is at least like a movement towards acceptance. Like maybe they're not going to accept all of this, but they will like come to a point that's acceptable for them. And then again, we work with the children on, okay, this is where they're at. How do we meet them? Right. And it's not ideal. I mean, in an ideal world, it would just be like, yeah, this isn't a big thing and everybody goes along with it. But we know that's not reality. So, it might be working with the kids on, okay, your whole identity is fully supported in this household. When you go to this household, it is not. So what are some things that we can do to make this, better, I guess? So does it mean that we wear kind of more gender neutral clothing at this house? Again, is that ideal? No, of course not. It's not. Could it be necessary? And could it be what keeps that child safe? There's also a lot that we need to, look at just in terms of when we are working with systems that aren't supportive. Is our best plan to do what we can to help this child build resiliency and keep them safe until they're old enough to be out of the house and make their own decisions, right? Again, not ideal. A lot of stuff will go into that. A lot of probably spot treating different traumas and just so much resiliency and so much ongoing work that will need to be done. But if it keeps that child safe and that's the option that we have to go with, that's what we will do. Even if it means, yes, you can use your name and whatever when you're in this room. And when I walk into the waiting room, I will use your dead name because that's what keeps you safe right now.
I'm also hearing a grief process for the child too.
Yes.
So
Yeah.
yeah, and
There's,
yeah, and layers there of
mm-hmm.
um, what it must be like to be accepted in some places and not accepted in others, and have to like not be able to be fully expressed in some
Mm-hmm.
places in life, and have to sort of
Right.
do this
Right.
sort of dance, kind of a chameleon dance a little bit. You know,
Yeah.
yeah,
Yeah.
yeah, just all and everything that's entailed with that. Hmm.
And you said something about, fear too as an emotion. That's a really, really big component of, I think, what caregivers think about because, again, we don't live in a world where every space is safe, right? And we know that as adults. And, how much of that do we want to explain to our newly transitioned 6-year-old child? Probably not a lot, right? So, again, there's I know for a while I vetted out everything. Like I was trying to micromanage that kid's life. So like to the fullest extent possible, you want to do soccer. Okay, let me research, this place. Who's the instructor? What's their deal? What are they like on Facebook? What have they posted? What, I mean, to a ridiculous level. But trying to protect them as much as possible while not, inciting fear in them. And then also as they get older, yes, there are spaces that are not as safe. And that's a reality that, we need to help you prepare for. There's little things like when you travel through the airport as a transgender person, um, when you go through okay, so there's two types of like detectors you go through, right? So kids 12 and I think 12 or 13 and under just go through the metal detector with their parents. And that works great until you're 12 or 13. Looking, 12 or 13 looking, because TSA doesn't know. So after that, you go through the swishy machine. I don't know what it's called, the swishy machine, where you put your hands on, it's like,
Yeah.
right? So before you get into that machine, there's a button that somebody pushes on the other side that's pink or blue. So they just look and see, do you look like a girl? Do you look like a boy? And they choose. And if they choose the wrong button, there's an anomaly, like there's something where it shouldn't be. And then that can ensue into a pat down or a search, which is just even more invasive and more like triggering for somebody that is already like, possibly not comfortable in their body. So, again, like at what point do you explain, okay, we're going to the airport. This might be a thing, what again, what if it's advantageous to wear gender neutral clothing? Or if not, like here's what we might expect. You can as a caregiver go first and kind of try to tip them off that you might want to press the blue button, whatever. But again, these are things that like little things that you don't think about that could that we might want to know about so that we can help our kids and the families prepare for something as something as minor as going through the security checkpoint at the airport, because that could blow up into a very
Yeah.
big situation if they're not ready for it, right? So
Yeah.
yeah.
Um, I want to ask some questions about how does this show up in front of us in the playroom? Because
Hmm.
I'm hearing just beautiful reminders for us on how to support caregivers and curiosity and really go get curious.
Hmm.
And I want to make sure that we touch on what are we also seeing in the playroom.
Yeah.
Just want to make sure we go there
Yeah,
before
yeah, yeah. Let's talk about that.
important.
So, in the playroom, you as a play therapist want to kind of look around and do a check of your playroom. Do you have toys that are very much gendered without realizing it? Do you have a house and the kitchen set's got all pastel, I don't know, things like that. Like how are you conveying as a play therapist that this is a safe space? So phrases like, we don't have girl toys and boy toys, we just have toys, you can play with whatever you want here. Do you have boy dolls and girl dolls? Do you have, like, you want to have a mixture of these things? If you have that, then what shows up in the playroom is that kids will work out the same way that they are working out any other thing in their minds that isn't quite fitting in and making sense. So they will grab the boy doll and put a dress on the boy doll and like, this is me. Or they will, maybe this is the space where they as a transgender boy can put on that cape and sword and play out as a different persona. They play out different themes in sand trays and just like figurines on the IKEA rug that every play therapist owns. Just what they do in their day, and they will play out themes like, oh, my name is this now. And so they will play out a bunch of those themes, and they will also kind of explore different um I guess meanings, like society driven meanings of gender, like, oh, I can't play with that because I'm a girl. It's like, well, yeah, but I mean, girls play with fire trucks too. I mean, there's female firefighters. So, there's also things like in their world, professions. Like if you, for example, if they have always had female doctors and female pediatricians, well, if I'm a boy now, if I'm a boy, then maybe I can't be a doctor anymore because only girls are doctors, or so, helping them play out some of those incongruent, thoughts and, kind of helping to find out what are the messages that they've been given. What is their kind of worldview on things and where do they fit into that? They will also play out if there is tension within the family. Here's mommy. Mommy is really sad when she looks at my baby pictures. Things like that. So they will play out all of those themes. And I get that asked this a lot too. Like, how do you do play therapy with a gender diverse child? exactly the same way you do it with a cisgender child. It's exactly the same. There's no new techniques. There's no new like modalities. There's no new, there's none of that. You do it the exact same way. But you, as a therapist, have a few more things in mind. You have things like you don't ask, do you want to be a boy or a girl when you grow up? Because they're whatever they are now. They don't have to wait till they grow up. So there's nuances, I guess, and there's information and how do you approach things, do you introduce yourself as, hi, my name's Jen, I use she her pronouns, like what is a pronoun? Oh, well, let's talk about that, like you can, you're infusing maybe some psychoeducation because again their family system might not have this language, and if it's just something that's a given where you are, like we have our pronouns at the end of emails and on the website, and we try to introduce ourselves with our pronouns, and we make it part of the conversation. It's just like it's also not oh, you're here and you're trans, let's talk about all the trans things, let's make sure we do that. That's not, maybe they are dealing with bullying at school that maybe is because of their gender status, maybe not, maybe it's completely unrelated. Are they out, or are they stealth? Do people know their story, or do they choose to keep that to themselves? What's the difference between keeping a secret and keeping something private?
Yeah.
um so yeah, kind of knowing all of those components, those are things that you are going to know going into the play therapy room. Yeah, and then they're gonna do all the play therapy
Me
things
too.
like any other kid would do. Like it's that's gonna be the same. So
So
yeah.
Jen, I have a final question I want to ask you. And it's a big question.
Okay.
And the question is, what advice would you give for a play therapist where this whole conversation just isn't fitting in their belief system,
Mm,
right? Or
that's really, yeah.
there's something about this that's really uncomfortable for them.
Mm-hmm.
And
Mm-hmm.
but because yeah, like what advice? Because
Mm-hmm.
they're not wrong in their belief system from
No,
that perspective.
right.
Uh, but what would you offer up?
I would encourage them to seek supervision or consultation to kind of tease out what is the part of this that is not fitting in with your belief system. Like, what is the part of it? Is it is there fear? Is there, your own family narrative? Is it like kind of what is the part of that that applies to you? And how does that relate to this child that's in front of you? Like how is your own stuff impacting that? And is it something that you can work through? Like, is it something that, because we all have clients that are just more difficult than others, right? They just have more challenging things that they're bringing to us. And, if there is a belief or there is something that is just maybe not going to be, also something that maybe you can't work through in the time span that you've got with this child, it's okay to tap out and refer to somebody who has more expertise in this area. That's fine. Because, and you talk about this a lot, your feelings, what you have going on is going to absolutely be felt by that client. And if they are feeling that there's a disconnect, if there's feeling that there's something there that's not fitting, you're not helping that child, unless you are really like sure that you can, you are able to set aside those beliefs or you're working through them, or maybe, also some people just, they don't know what they don't know. Once they have a better understanding of what some things are, then it's like, oh, okay, that makes sense. I can work with that. Right. But it's also just, I think that the presence in the room or even online, if you aren't able to regulate yourself with whatever that is, then that's probably really not good for your client. And I think that we all have things like that that are just like are, you know, not going to be able to do. Like
Yeah.
I don't have guns in my playroom. I understand the therapeutic significance. I understand like how they can be used and all of that stuff. It's really, really triggering for me. I can't regulate myself. I know I can't do it, so I don't have them there. I have noodles and other things. So, if there's just something like that that then, it's okay to, refer them to somebody that just has a different, a different, viewpoint on that. That's okay. But, before you do that, get curious,
Yeah,
ask questions, don't assume, also know that your narrative of what you think is like this, like that might not fit. Like your narrative of what you think this whole situation is once you talk to that family and talk to that child, that might not actually be a thing either. So, ask, get
hearing
curious.
permission, which is beautiful, right? I'm
Yeah.
hearing permission for therapists to know themselves, to be
Hmm.
curious about their own activation,
Yeah.
um, and then to make decisions about that. Uh,
Hmm.
and that yeah, permission, just permission, permission,
It's
permission.
just permission. Yeah, you don't have to be everything to everybody. It's okay.
So Jen, where can individuals find you? And as I say that, there might be individuals that just have questions or want to know more,
Hmm.
want more resources. And then there may also be individuals connected with organizations that may want to invite you in to do
Yes.
training discussion on this topic. And I know there's other things that you teach on too. Where can
Yeah.
people find you?
The best place is my website, jennifershivey.com. So there's a whole section of trainings that are available. Yes, I love speaking to other organizations and places, and just kind of spreading some awareness and some insight, because yeah, this is so prevalent and it's so, I just think it's information that, therapists really need to have right now.
Yeah. Um, well, thank you so very much
Yes,
for
thank you.
thank you for joining me. Thank you so much for educating us and for being a voice for the mountain.
Yes, yes,
Right? Yeah, thank you so much, Jen.
thank you.
Yeah. So, listeners, my hope is you'll review this. You'll listen to this more than once. You'll sit with it. You'll reflect on it. You'll look at your playrooms. You'll consider the different pieces that Jen has shared. That you'll stay curious. Go do more research. Go do more learning. And as always, wherever you are in the world, take care of yourself. You're the most important toy in that playroom. Until next time.